In my practice as a neuropsychologist, I see a lot of patients coping with PTSD symptoms. And a really common question that I get is, what are the best treatments for PTSD? Should I do therapy? Should I do medications? Or what would be best? Hi, I'm Dr. Adeline Leon, licensed clinical psychologist with Mental.Health.Merienda.
And I'm Michelle Young, licensed clinical social worker. So the short answer is that both psychotherapy and medications can help improve PTSD symptoms. But let's start with psychotherapy. So there are a few ways you can find a psychotherapist, though it might differ a little depending on where you live.
So, number one is that you can speak to your primary care doctor, your PCP, about your concerns. He or she can likely give you a referral for psychotherapy. A second place you can look at is look up psychotherapists on the website of your insurance and then check to see who's in network. Actually, kind of the same way you would look up any other doctor or specialist on the website for your insurance, you could do the same for psychotherapists. Number three is, and this one, I recommend this all the time. It's the Psychology Today website. So it's www.psychologytoday.com. And on that website, you can look up, there's a therapist locator, and you can filter by so many different things. If you prefer male versus female, if you prefer someone who has a religious affiliation or not, if you prefer someone who follows a certain type of therapy modality, you can filter through all of the providers, also insurance coverage, and then you can see who would be the best fit for you.
Yeah, that's a great resource. I use it all the time as well. So if you're using a search tool to find a psychotherapist, again, like Adeline was saying, you can filter by different results and again, get that tailored experience that you want and find someone who's a good fit. Some types of psychotherapy that have been shown to be the most effective in treating PTSD include cognitive behavioral therapy, or CBT. We've mentioned this so many times in our other videos, but CBT is just a really great evidence-based practice. So it's useful for all kinds of conditions, not just PTSD, but even like depression, anxiety. So you'll always hear us talk about it. But CBT is really helpful. This is a type of talk therapy where you recognize your thinking patterns, so cognitive patterns that are keeping you stuck. So for example, any negative beliefs, we call them cognitive distortions. So it's all about learning to identify those about yourself and then also working on ways to have a different response or to think differently and have a different action. So for PTSD, cognitive therapy is often used along with the next type of therapy that's also helpful is called exposure therapy. So exposure therapy is a type of modality where your therapist is going to safely and slowly introduce you to those situations and memories that you find frightening or that can remind you of the traumatic event, so that you slowly, little by little and done in a safe way, are getting exposed and then having a different reaction to that incident or to that situation or memory. So this is found to be pretty effective. It helps you with coping with the flashbacks, the nightmares that tend to be associated with PTSD. And there's also even virtual reality programs, which I think is really innovative and cool, especially in today's age. But these types of programs can help you, again, expose you little by little to those situations that you experience trauma and help you with that trauma response.
Yeah, and I just wanted to add, you can probably imagine exposure therapy. It's difficult. I think the thought for most people of being exposed to this trauma and this thing that's really, really distressing to them seems like, why would I do that? I don't want to do that.
Yeah.
But I think the goal is that if you continue getting exposed to it, again, like Michelle said, in a way that's safe, in a way that's slow and progressive, then it's almost like your body gets habituated to it, like your body gets used to it, instead of having this kind of like big response and this hypervigilant arousal response. Your body slowly is kind of like, okay, I'm okay with this. This is safe. This is okay. I don't need to react to this.
Yeah, because part of it too is that your body remembers the trauma. So you're also, the idea behind exposure therapy is that you're helping your body kind of decrease that emotional response. So it's not always heightened, like you were saying. So another modality that's been proven really helpful in treating PTSD is something called EMDR. So EMDR combines exposure therapy and a series of guided eye movements to help you process those traumatic memories and also change how you react to them. It's like a nice combination of exposure therapy, plus a little bit of like cognitive behavioral therapy, but EMDR is actually like really helpful. So something to keep in mind with therapy is sometimes it takes a few tries, or it takes time to find the therapist that's going to be a good fit for you. So if you find a therapist and maybe that first one it wasn't a good fit, don't be discouraged. There are many other therapists who who would likely be a better fit. And also in terms of trying these different modalities, sometimes maybe, you might not respond well to one and then you'd respond well to another. So give it some time and give it some patience, and definitely talk to your therapist and keep that communication open. But sometimes with therapy, it takes a little bit of trial and error. So just something to keep in mind.
Yeah, that's a really important point for people to keep in mind. So, another type of treatment for PTSD are medications, and those can be really helpful as well. And there's a few different kinds that you might be prescribed. First one is an antidepressant, and those can help with feelings of depression and anxiety that you can have with PTSD. So, even though you don't necessarily have depression, you can have some symptoms of depression, and the medication can help treat those. And they can especially be helpful for sleep problems, which you can have a lot because of the nightmares, and then concentration issues, which you can have a lot because of the flashbacks and the arousal and the hypervigilance. So SSRIs are medications that can often be prescribed. So those would include sertraline, which is known as Zoloft, Paxil, and those are approved by the FDA for PTSD treatment. Second kind are anti-anxiety medications. So these can include like Xanax is the most well-known one. And these are meant to relieve severe anxiety related problems. So if you have, for example, a panic attack that's related to your PTSD, and in the moment that you're having or about to have a panic attack, then that's what these medications are used for. They tend to be prescribed, not always, but they tend to be prescribed as needed. They are often used for a short period of time because they can be habit forming. So that's one thing definitely to look out for. And the third one is prazosin. I actually have seen quite a few patients with PTSD who are prescribed this medication specifically. It's actually meant to target and reduce or suppress the nightmares. Because out of all of the symptoms of PTSD, some of the ones that can be most distressing are the nightmares. And you can imagine trying to sleep and you can't sleep. So there's also the fatigue and the lack of concentration and just kind of, sleepiness, obviously, of not being able to sleep well, and how distressing those nightmares can be. If someone is considering prazosin, they should speak with their doctor to determine whether or not that particular situation might merit that drug. So that drug is not necessarily the best for everyone with PTSD, but for some people with PTSD, it could be very effective.
So in addition to medications and psychotherapy, there are also just good habits to have in your life that could help manage any symptoms of any mental health condition. So self-care, practicing good self-care. So with sleep being a problem for a lot of people with PTSD, so one thing you can do is just practicing good sleep hygiene. And what that means is having a routine to prepare your body to go to sleep. So making sure you're going to sleep at an early and good bedtime, things like that can help with the sleep issues that can come with PTSD. And then along with that is just getting enough rest, eating a good, healthy diet, making sure to get exercise. Exercise is just good for everybody. And then also good stress management, and then avoiding foods that can cause or trigger anxiety, not cause, but maybe like trigger or make it worse. But foods that have a lot of caffeine, nicotine use can also worsen the anxious symptoms that come along with PTSD. And then staying connected. So as much as possible, spending time with people that you love, family, friends. If you are part of any groups like religious or non-religious groups where you find that you have a connection, maintaining those connections are really important. You don't have to talk about the trauma and what happened with those individuals necessarily, but just spending time maintaining those friendships and connections are also really good for your mental health and can help you in the healing process.
I think with PTSD, people can self-isolate a lot and just you get more in your head, more in your thoughts, and that could be so harmful. So I feel like staying connected, of course, it's good for a lot of reasons, but that's probably why it could be really helpful for PTSD specifically.
Yeah, for PTSD, it's really easy to self-isolate because you've gone through this traumatic event, and then it's really hard to engage with other people and feel connected to the people, even the people that you feel close to. So as much as you're able to stay connected and maintain that social support, that's going to be really helpful. And then the last one, and it's related to staying connected, is to join a support group for others who have also been through PTSD or who are also experiencing that. So if you are seeking therapy, talking to your mental health clinician about if they know of any support groups. So we mentioned this organization in our other videos, but NAMI is a really great organization. They have local chapters in all over the United States. NAMI would likely have support groups for PTSD as well as for other things. But support groups are really helpful because you get to be around people who have similar experiences with you, and then it helps that staying connected. And then also, if you are a veteran, for example, a lot of veterans struggle with PTSD. Your local VA would probably have resources of where to go for support groups. But being connected to a support group is something that would be really helpful to add to your treatment plan.
Well, tune into our other videos to find out more about PTSD as well as other mental health conditions. Thanks for watching.
Thanks. Bye.
Bye.